I request Dr. Aditya Thorkar to present his paper.
Good afternoon everyone. My topic of presentation is Clinicopathological study of Sino-Nasal and nasopharyngeal masses, a case study of 100 cases. The nose has a basic function of warming, humidifying and to some extent filtering inspired air as it paves way for respiratory tract. It houses olfactory neuroepithelium, mesodermal and epithelial derivatives. Sino-nasal cavity and nasopharyngeal masses poses diverse pathological entities ranging from simple nasal polyps to malignant tumors, and they have potential to produce diverse symptoms, signs and complications. Sino-nasal malignancies are unique, uncommon and contribute less than 1% of all malignancies, and the diagnosis of sino-nasal malignancies is most of the time delayed, diagnosis being done at relatively advanced stage. So early diagnosis is crucial for management and improved outcomes. So imaging, CT scan, MRI techniques are essential for diagnosing extent and characteristics. Various approaches are formulated based on nature, location and stage of the nasal mass. My objectives were to evaluate methods for early diagnosis, to identify reliable diagnostic approaches, to distinguish neoplastic and non-neoplastic etiologies, aims to analyze effectiveness of different strategies, to enhance understanding and management of complex conditions. It was prospective observational study done at tertiary care center. 100 cases were taken for study of sino-nasal masses during January 2023 till November 2024. Complete history, clinical examination, radiological examination and histopathological examination was done for correlation of clinical presentation with diagnostic findings were done to formulate effective treatment. Among the 100 patients, 82% cases were non-neoplastic etiology, mostly sino-nasal polyps, 9% being benign neoplastic etiology, and malignant neoplastic masses were of 9%. Then most common age group affected was from second decade to fourth decade of life. The peak incidence was mostly being in fourth decade of life. Then second to fourth decade of life, there were most commonly non-neoplastic nasal masses, and neoplastic nasal masses were common after fifth decade of life. Then of 100 patients, 64 patients were male and 36 patients were female patients. Then out of 100 patients, 71 patients presented with bilateral nasal masses and 29 patients were of unilateral nasal masses. Then among the neoplastic nasal masses, most common benign nasal mass was of capillary hemangioma followed by inverted papilloma, and most common malignant nasal mass was neuroblastoma. Other malignant cases were of adenocarcinoma, non-Hodgkin's lymphoma, sino-nasal undifferentiated carcinoma, anaplastic carcinoma, squamous cell carcinoma and small round cell malignant tumor. Most patients most commonly presented with complaint of nasal obstruction, and other complaints were most common other complaint was nasal discharge and nasal bleed. Other associated complaints of patients were facial pain, facial swelling, epiphora, toothache. Among the 100 patients, 4 cases were with recurrence of a disease. Out of those 4 cases, 3 patients presented with unilateral recurrence and 1 was with bilateral recurrence. All of them were of benign etiology, and these cases which presented with recurrence were capillary hemangioma, inverted papilloma, bilateral sino-nasal polyp and a case of nasal angiofibroma. After my study, third decade was peak as compared to fourth decade, which was compared against study done by Ushma Patel et al. And second decade in a study done by A. Lathi et al. Sino-nasal masses are more common in males and males, with male is to female ratio of 1.7:1 in our study compared to male is to female ratio of 2.3:2 in study done by Ushma Patel et al. Then 1.5:1 in A. Lathi et al. And so most commonly males were affected compared to female. Then male is to female ratio for benign lesions was 1.6:1 as compared to 1.4:1, and for malignant lesions it was 8:1 as compared to 3.3:1 against study done by A. Lathi and et al. Among the sinonasal masses, 29% patients presented with unilateral nasal mass and 71% patients presented with bilateral nasal masses compared to the study 48.21% unilateral and 51.78% bilateral nasal masses in a study done by A. Lathi et al. Then conclusion, sinonasal masses have various differential diagnoses. Benign conditions peak during 2nd to 4th decade of life. Neoplastic nasal masses were common after 5th decade of life. Then sinonasal masses presented with similar but non-specific presentations, often requiring imaging investigations like CT, MRI. Histopathological examination was gold standard for definitive diagnosis. Medical treatment was often inadequate, requiring surgery. Then surgery was a treatment of choice for benign nasal masses, and combination of surgery and radiotherapy is helpful in malignant conditions. These were references for my study. Thank you.
Thank you. I request Dr. Sachin Deshmukh to felicitate Dr. Aditya Thorkar.
Great.